Hi, everyone. I'm Jason Chapin, Director of Workforce Development at Westchester County Association. Welcome students and parents and alumni and other job seekers to WCA's Career Chat. We're going to share some great information about rewarding jobs and careers in healthcare. Before I get started, I want to thank our Platinum sponsors for supporting WCA in this event. And before I introduce our guest, I'd like to thank our healthcare heroes who now more than ever, serving on the front line tirelessly and selfishly, are caring for others during the pandemic. And thank you to the 17 colleges and BOCES and Westchester County Workforce Board and Career Centers for supporting this event. Now let's begin. It is my great pleasure to introduce Catherine Watanabe, Recruiting Manager at Open Door Family Medical Center, and Kelly Barron-Cadiz, Senior Director of Workforce Development and Planning at WMC Health Network. Welcome.
Thank you so much.
And thank you for joining us. Okay, I have a few questions for you, and then we'll open it up to job seekers who might have additional questions. And job seekers, I'd appreciate if you could go to westchester.org/survey to answer our 60-second survey so we have a better idea of who's watching, and we'll be able to follow up with you and answer your questions. So thank you, and I'd like to start with Catherine, if you could tell us about your organization.
Sure, absolutely. For about close to 50 years, Open Door now has been a trusted resource for our local communities, providing primary care, dental care, behavioral health and wellness, chronic disease management, and more programs to nearly 60,000 individual patients who might not otherwise have access. So we do have 7 sites, clinical sites right now. Brewster, Mamaroneck, Mount Kisco, Ossining, Portchester, Sleepy Hollow, and also Saugerties. And we are also in 8 school-based health centers, both in the Portchester School District as well as the Ossining School District. And you may have seen some of our mobile dental units as well.
Wow, I'm thinking it's Open Doors, not Open Door. That's great. All right. Kelly, can you tell us about your organization?
Sure. The WMC Health Network has 10 hospitals across 8 campuses. We also have 3 long-term care facilities, assisted living, home care services, as well as a wide variety of specialty services and physician practice offices. We are an academic medical center, so we do offer level 1, 2, and pediatric trauma, adult trauma, specialized institutes and centers, again, skilled nursing, and we are employing over 12,000 people currently and 3,000 physicians. We're hoping to meet a few more employees right here today.
I'm sure you will. Okay. So now, and again, starting with Catherine, could you tell us about some of the open positions you're trying to fill, and remind our viewers that you're not just filling direct care or healthcare positions, that your organization, Kelly's organizations, have lots of different positions.
Yeah, absolutely. I mean, the current climate is changing the way some of us are working today and networking, but we are still hiring for our sites. Currently, we have 3 open LPN roles, one in Portchester, Sleepy Hollow, and another one in Mount Kisco. And we also have 4 bilingual medical assistant roles open as well. Those are in Portchester, Mamaroneck, Sleepy Hollow, and Mount Kisco. And to be honest, I'm always keeping an eye out for bilingual call center candidates, which would be based at our Ossining Administration Building.
Okay, and Kelly?
Great. Similar to Kat, we have many different facilities and we have many available jobs today. We are especially in need for clinical lab technologists, respiratory therapists, and nurses. But in addition to those clinical roles, like Jason, you alluded to, we also have many other opportunities that are non-clinical, such as environmental services, financial analysts, revenue integrity, patient service representatives, which are greeters in a physician's office, a call center, scanning, program coordinators for our academic medical center. We have many opportunities, again, across a wide variety of an area. We cover 6,200 square miles of the Hudson Valley. So there are something in it for all of you in an area close to home.
All right, and so today we're talking about jobs, and it's also important to talk about careers. And I'd like to start with you, Kelly, if you could tell us about some of the career pathways that are available at WMC Health.
So at WMC Health, we are committed to the employees and to their career path. I am a perfect example of that. I started as an RN 17 years ago with the WMC Health Network. I was at the bedside. I moved into an education role. I then moved into human resources as a recruiter, became the director of recruitment, and today the senior director of workforce development. And again, we are committed to our employees from the ground up. So from hire to retire, we are here to groom you and grow you both personally and professionally.
Oh, it's the first time I heard that phrase, groom you and grow you. And I love the term professional growth and having opportunities to learn new things and to do different things in an organization. Okay, and Catherine, can you tell us about some career pathways at Open Door?
Absolutely. I mean, we share the same sentiment. It's your work family, spending as much time at work as you are with your families, generally speaking. It's a good group to be with. And we do promote from within. We really encourage that, but it's no pressure in case you do like where you're at and want to stay there. But we certainly have had people move up throughout the ranks, being promoted from call center into other areas of the business. We've had LPNs that have gone back to school and become RNs and stayed with us. And it's just a great career experience.
Yes, and that reminds me that healthcare in general has been a great sector in terms of opportunities, in terms of growth. And that's been the case for many years, and that's going to be the case for many years to come. So it's really a wonderful sector. And I also like to mention that we have so many people who have been raised locally, who are attending our great colleges locally and really want to stay in the area. And it's great to know that there are great job opportunities for them. Okay, so I'd also like to start with Catherine. If you could tell me what you think makes a good candidate. What are you looking for when you're interviewing and looking to hire somebody to fill a position?
Sure. Interviewing for a new job and a new organization is a little nerve-wracking. It's a change, and it's not always the most comfortable thing in the world or the most comfortable thing to go through. So what I always suggest is just being honest. And if you are nervous, it's okay. But definitely share your excitement. A new career path is something that both of these organizations are promoting and love to talk about. So certainly if those are your true goals, then don't be afraid to mention that. It always starts with a conversation, and it's both ways. It's the organization interviewing you as a candidate for the position, but also you're interviewing us as well to make sure it's the right long-term fit.
Okay, thank you. And Kelly?
Yeah, I would just like to add to that. I agree with everything that Kat just said. And I would just like to add to that to be prepared to talk about yourself for the interview, what you're really looking for, what your goals are for yourself and for your future, and the reason why you're choosing our institute or one of our institutes as your career goal choice. I think you need to be on time. If we are doing a telephone interview, which we're often doing in today's climate, make sure that you're in a quiet place without distractions. And that can sometimes be challenging because we have our kids home today. So can we get to a place that is quiet and safe without that distraction so that you can really focus, so you can key in on the being asked of you, and as well to be prepared to ask questions of those recruiters that you're speaking to or those hiring managers that you're speaking to. Know a little bit about our organizations ahead of time and be prepared to ask some questions.
That's great advice, and it reminds me that there are some people who maybe have a career goal in mind, but maybe recent circumstances have forced them to rethink that. Maybe they weren't in healthcare and they're thinking, well, maybe the best opportunities are in healthcare. Do you have any examples, and we'll start with Kelly, about people who didn't necessarily have a lengthy career in healthcare, or they decided to make a career change and they got the training, the credentials they needed, and then they interviewed with you?
Yes, actually, we do have a program in association with the Westchester County Community College that we have a coding program. So you can join the program, come in, take a coding class. This is for our current employees as well. And they become certified coders. And then we can move them into a different role within our organization, within various of the facilities within our organization. We've also had nurse aides come in, become certified nurse assistants through a nursing assistant program that we have developed. They can then move on through tuition reimbursement that we offer to our employees to move on to an LPN, to move on to an RN. There are many areas in which we can help you grow. We are committed to that professional pathway. Again, like Kat said earlier, if that's what your goals are for yourself, we have many avenues that we can support you with that, tuition reimbursement just being one of those ways.
Yeah, that's great. So you want to have some training before you start an organization, but a lot of organizations offer some tuition assistance and in-house training and other opportunities to get additional training. But we'll talk about that next. I wanted to give Catherine an opportunity to answer the question about people who may not have been set on a healthcare job, or maybe they're making a career change and they want to get into healthcare, if that's something that has happened before or happens often at Open Door.
Absolutely. We're a very diverse group. We do not hire only recent graduates or 1 to 2 year out of school or certification programs. It's definitely a diverse population that we work with, and we enjoy that. We feel inclusivity is very important, and we also have tuition reimbursement programs as well, and just we ask people to take part of it so that they can better themselves, they can better take care of our patient populations, and work even better together.
Yeah, so there's a lot of opportunity, a lot of different training and pathways. And so I want to start with Catherine. I know that there's an ongoing debate about whether it's more valuable to be a specialist or a generalist, and what do you think is the situation at Open Door? Do you have people who just do one thing, or are they cross-trained and they learn other things and they do other things?
Right. Our environment is very collaborative, so we do often have quite a few different people or different employees that will help out with other things as well. We are a nonprofit, so we don't necessarily have a different position and specific job description for every single person. So we do, definitely collaborate in a team setting. And it's nice to see that when someone is struggling with something, someone else will jump right in to help out.
Okay. And Kelly?
Yeah, I agree with Kat. We seem to be really right on the same page here. There are certain positions that require a specialist. However, that being said, collaboration, like Kat mentioned, is really the key. And especially in the most recent climate that there is today, we redeployed many people to work across many different lines, certainly never out of the scope of their practice or never beyond their capabilities, but certainly we came together, we worked as a team. I think Kat alluded earlier to feeling like a family. And even though we are a very large network with over 12,000 employees, we are a family, we are one, and we do collaborate, we do work together. So being a generalist or being a specialist, there's a place for both of those because they cross lines, right? We all work together.
Okay, and we've covered a lot of ground already, but I don't know if we've missed anything. And I want to start with Kelly. If there's anything that you think our viewers should know about your organization that we haven't already discussed, and then we'll probably have some questions from our viewers that we'll go through.
Sure. I just want to let you know that if you were to become an employee of the WMC Health Network, we are committed to our workforce. We are committed to your mental, spiritual, and financial well-being. We have this very robust program called Total Rewards. And in that, we allow you to look at the home host tool that shows you all the physicians that accept the insurance, the great benefits that we offer. We have retirement plan built right in there, the mental wellness, and we really are committed to you as an individual and to you as a professional. As much as you give to our organization, we want to give back and thank you for your commitment to us and to your loyalty to our company as well as our community.
Yes, you mentioned benefits, and I know it's a great thing that healthcare providers provide health insurance for their employees and many other benefits. Yes, okay, and Catherine, I would also like to ask you the same question. So, in terms of different things that you offer your employees, is there anything that we haven't covered that you want to make sure our viewers are aware of?
Yeah, I mean, very similar sentiment to what Kelly said about work environment and commitment to both employees as well as the organizations too. We do also have benefit programs that you can customize for each individual, whether it be medical, dental health, even pet insurance, things like that, life insurance, hospitalization insurance. But we do also have other programs. We briefly mentioned tuition reimbursement earlier. We also have a 401k and a 403b, as well as generous PTO as well.
Great. So I know that we have a few questions that have come in. I want to remind our viewers that if you have a question, just go to the comment section below and we'll try and get to that. And if we don't get to all questions, we will share them with Kathleen and get some answers from them. And then we will share them and post them on Facebook and other places. Okay, so the first question is that this person wants to know what you are looking for in a medical assistant, and in terms of finishing a program, and what would you like them to do in terms of working with you? So let me go over that again. It's a little confusing. I wanted to know what you are looking for in a medical assistant that is finishing a program and would like to work with you. There we go. Let's start with Catherine.
Sure. For medical assistant roles, there is a certification that you do need to complete after finishing the program. All of our medical assistant positions currently are requiring bilingual Spanish speaking skills just to communicate better with our patient population. And just, again, being able to work in that collaborative team environment, being able to help out if you see another medical assistant or patient service representative having, an overload or something like that, or dealing with an emergency issue. We very much support the team setting.
All right. And Kelly, your thoughts?
So you're going to get tired of hearing me say this, but very similar to what Kat just said. Medical assistants do have a certification that can be completed once you finish your schooling. What we're really looking for is the right person that is going to greet our patients with a friendly smile, to be sincere and upfront and accommodating. Customer service skills cannot be overlooked. They cannot be overinflated. The importance of just being genuinely friendly, caring, and wanting to work as a team, like Kat said.
All right, I think we have a few more questions. And the next one is, if a student graduates with a certificate in respiratory care, are there opportunities even if they are new to the field? And let's start with Kelly.
So if you're referring to respiratory therapist, we do hire new grads into respiratory therapy care. We have, like I said, we have 10 hospitals. We also have the long-term care. We do have a need for respiratory therapists, a great need at this time especially. And we do welcome new grads, and we do support the new grad once they come in with a onboarding orientation, assigned a preceptor or mentor to work with them, and make sure that we get you up to par with the actual clinical skill, not just the classroom skill that you.
All right. And just a reminder for our viewers, if you could go to westchester.org/survey, we'd really appreciate your feedback. It's a 60-second survey, and you know how important surveys are. It'll help us when we do more of these in the future. Okay. And Catherine.
Absolutely. At this time, we don't have those types of positions, but if they do come up in the future, we'll probably be following exactly what Kelly just said.
Okay, good answer. All right. And the next question. Does your organization offer an internship for billing and coding? And we'll start with Catherine.
Sure. Right now, we don't have any interns on site due to the current situation, but in the past, we have had interns helping out in that area, medical coding, and not so much the billing, but definitely on the coding side. And then we also have, if you look at our website, opendoormedical.org, and on our careers page, when we do have internships that we are looking to add to, we do post them all there, whether it be in the care programs, communications, etc. They're typically all posted there.
Okay. Thank you for that answer. And Kelly.
So we don't currently have interns on site either for the current climate that's out in the world today. But similar again to Kat, we do have intern experiences. The first thing I can think of really is a pharmacy intern experience that we have ongoing and regularly. But we do post those intern experiences on our job board when they do arrive. And we do have, like I mentioned earlier, the collaboration with Westchester Community College and the coding class that is offered through that program. So we do have opportunities in the medical billing coding area.
All right, these are great answers, and we have some more great questions. And this next question is similar to many other questions we received. And we will start with Catherine. Will you hire new graduates for nursing who have limited license permits while waiting for the NCLEX testing to reopen as usual?
Right. At this time, we are requiring the licensure, and I understand it's difficult because Prometric and I forget the other name of the other testing center that's big in Westchester. I know they're having issues right now rescheduling all of those, but there is an opportunity to look at all of our other positions that are open that perhaps don't require those licenses, and perhaps you can interview for those if they speak to you or if you're interested in them, and then we can take a look. And certainly once you do complete, when the testing centers are open and when you are able to complete those exams and pass them, then we could take a look at moving you over into one of those positions.
Thank you for clarifying. And Kelly?
Yes, unfortunately at this time, we've not waived the requirement of being licensed as a registered nurse to work for our facilities. However, I would encourage a new graduate, once you receive what's called your ATT number for nursing, that means that you've met all the requirements and you're eligible to sit for the NCLEX exam. At that point, I would encourage you to apply for the positions that we do have available online. And you can connect with a recruiter at that time, and we can begin to talk about really what your desire is, what type of nursing you want to work in, what type of availability and open positions that we have that might meet those needs for some mutually beneficial relationships, and we can get you in for some interviews, and so we can begin the process before you become licensed. We just ask that you have your ATT number ahead so that we have a pretty good time frame of when you might be able to sit for the exam and become licensed, and then we can bring you on board.
Okay, great details. And you may have noticed that we posted the email addresses for Catherine and Kelly so that viewers can contact them directly with any other questions or to find out more about opportunities. And also to remind our viewers that this is being recorded and it will be available on demand if you missed any of the information. Okay, I think we have another question. And my question is for WMC. I am a phlebotomist. I am looking for a full-time position. I have 3 years experience. Would there be opportunities for me at WMC?
Well, looking at your question across my screen, it looks like you have some really great experience in addition to your 3 years of phlebotomy. The fact that you have EKG, BLS, these are really great attributes to have and could really make you stand out against other candidates looking for the same type of job. And yes, we do have phlebotomy positions. We have them across our network. I encourage you to go to our job board, search for the city that is most convenient to you, and look to see if there's a phlebotomy position close to home. I know you said WMC. We certainly do have positions here at WMC for phlebotomy. So please go on our job board and fill out your application.
All right, and there may be others who are interested in Catherine's answer if you have any need for a phlebotomist with some of the other related credentials.
Not at this time. However, again, if not seeing the full resume, I don't want to disclude anyone from any of our current open positions. So feel free to take a look at our website as well. Our job listings are always updated daily. And certainly if you see something there that speaks to you, or if you wanted to send your resume over to me to take a look, I'd be more than happy to look.
All right, great. I think we're almost done. There may be a few more. Yes, there are more questions. Okay. And this is for both of you. After applying for a position, what is the hiring process like? And let's start with Catherine.
Sure. I mean, the hiring process, you are either, as soon as we receive your resume or your application, or both, myself and there are a few others in our HR team as well will always take a look and try and get back to you electronically, if that's the way the information came to us, as quickly as possible, just to let you know, yes, it was received, we're reviewing it. And typically within 1 to 2 days, you're either given a phone call or sent an email to try to set up a quick phone screen. At this point right now, we're only doing virtual interviews. But we do have the platforms like WebEx and Microsoft Teams or even FaceTime, that we can get those things done. It's not a crazy long process where you're waiting for months. We leave that to credentialing. But it is relatively quick as far as at least contact. And if you do not necessarily meet the requirements of the specific position, I always try to let people know, but also, hey, maybe you'd be a better fit for this other position that's open, and just kind of give you an idea of what that's like.
All right. That's very good information. And Kelly, can you tell us about your hiring process?
Sure. Again, it's pretty similar. We receive all applications through our applicant tracking system, which you would do once you go to our job board and you complete that application. A recruiter then that's assigned to whichever position you applied for would see your application and your resume if you attached it, and they would look to that and make sure that you're qualified for that particular job. Like Kat just said, if you're not qualified for that job, you may meet the needs of a different position, in which case you're not necessarily excluded as a candidate. We would just maybe call you to bring you toward another position that you might be more well fit for. However, if you do meet all the requirements, you would get a phone call from one of our recruiters on our recruitment team, and they would conduct a pre-screen with you. And then they would move your application on to the hiring manager, who would then set up an interview. Again, a virtual interview today using one of the platforms that Kat mentioned. We do use WebEx for our facilities. And you would have either a telephone interview or a virtual meeting through WebEx with that hiring manager. From there, the managers decide who they want to hire. And from that point forward, once we make an offer, there's a background check and occupational health. And it might take about 2 weeks in total from the time you apply, if everything goes very smoothly and you're the front-running candidate right from the start. So it's a pretty quick process. And we encourage you to go on our job board and apply for those positions that you're interested in. Yeah,
and I've heard anecdotally that the hiring process has has been shortened, that some of the decisions are being made much faster. I don't know if that's due to the healthcare crisis that lots of hospitals and medical groups have been facing, or just because you're using different technology and different platforms that allow you to accelerate that process. But it's good to know that you can get a response almost immediately, and that you could be interviewing within days, and there could be a hiring decision within a week. That's fantastic. Okay, and I think there are a few more questions. And the next one is, do you have jobs for new graduate nurses or offer nursing residency programs? And let's start with Kelly.
So we do welcome and hire graduate nurses, new graduates, into all of our facilities. It is exciting to be a new graduate. It's an exciting time to come into nursing. We are revamping a nurse residency program right now. That's part of my workforce development team's goals and initiatives, is to bring back our nurse residency program. So exciting things to come for nursing. But at this time, we don't offer the residency program, but we do hire new graduates. And we offer an extended orientation to those graduates, preceptor mentorship.
Okay. And Catherine.
Yes, very similar sentiment. New graduates are welcome to apply to the positions that we have posted. Unfortunately, right now we have one RN position posted, but it's more on the community health nurse side. And that is requiring a couple years experience just due to the nature of the workload. But yeah, we do encourage certainly new graduates to apply when we do have open positions like that.
Yeah, and that's a reminder to job seekers that it's always, I think, more important to visit the organization's website than some of the job boards, because the information is probably likely to be more current and also give you access to additional information when you visit the employer websites. Okay, thank you. We have more questions. The next question, and we'll start with Catherine. I have a background in quality assurance and quality control, working in pharma, medical device, chemical, and interested in a sterilization position. How would a person with my background transition to other non-medical opportunities?
That's an interesting one, because we don't necessarily have those types of positions. We do have a lab. However, I haven't seen any positions like that come up. I don't know if Kelly, maybe you have a different outlook or opinion on that?
Well, I would say that we would require to know a little bit more about you as an individual to be able to say what type of position you may or may not be qualified for. But I'd say first thing is, what would you like to do? Because it sounds like you have a pretty broad range of experience, which probably gives you a strong customer service base. I'm guessing that you dealt with many different types of people in those past positions. And so you're probably bringing a very confident personality, I'm hopeful. And this is just a real quick overview from one sentence question. But I'd say go and look and try to find what you want and where you think that you fit. And then we would take it from there. But certainly, as Kat said to another questionnaire earlier, send your resume in and we'll take a look. Include a cover letter. Hey, I was the person that put that question on the board. Can you take a few minutes to look at my resume? And we'll remember you, and we will take a look at that, and then we'll get back to you and see where we can find something that's mutually benefiting.
Okay, very helpful. And the next question, are positions available in management and human resources? And we'll start with Kelly.
So we do have a multitude of management level positions available. And we do have a few HR related types of positions. So again, depending on where you want to work, the location, I would encourage you to look for the facility that you're interested in. You can search on our job board either by position title, department, keyword. You can search by city. You can search by facility. So I would say, what exactly is it that you want to do? Are you looking for like an HR generalist job? I don't believe today I have that exact position open, but if you're looking for something in benefits, there may be a benefits position that's available to you. So I would say to go in and look. We do have upwards of 300 plus jobs and positions, various types of positions available throughout our network. So it really depends on what you're looking for.
All right. And Catherine?
Very similar answer. You're going to get very tired of me saying that. Sorry, Kelly. But yeah, at this time, we don't have any HR positions open right now, but that could change down the road. And when we're talking about providers, sometimes, the title of manager is a little unclear. We do have some provider positions open as well. But we would really need to take a look at what it is that you're looking for and what your background is. But certainly, feel free to send your information over. It will get looked at.
Yeah, and it's probably good to be flexible. I'm sure you both have examples of somebody who wanted to work in one location, but the opening was in another location. But over time, there was the opportunity to move to the other location. And so I think it's good to get in the door and demonstrate that you are a team player and that you are providing value to the organization. And then you can always let them know if there is an opportunity at another location that you would be interested in being considered.
Absolutely.
Okay. All right. Are there other questions? Yes, there are. This is great. Can students reach out to you through their college university placement offices? How does that process work? And we'll start with Catherine.
Right. Well, we have been, especially over the last few weeks, been very, very much in touch with the different universities and colleges and programs in regards to candidates that perhaps may be looking for a job. And again, this is not, this is for recent graduates, but also for alumni too. And it's been a great resource for us. This whole thing had started off today virtually because of Mercy College, right, Jason?
That's correct. Yes, and just before we get Kelly's answer, it's just a reminder that we've had a group of maybe 40 organizations, colleges, BOCES, and career centers, as well as hospitals and medical groups and some other partners who have been working very collaboratively, sharing a lot of information, understanding that there are a lot of employers with some immediate hiring needs. There's a lot of job seekers, whether they're graduating or off, and we're trying to be the intermediary to create our own little job market to help make those connections in order to help the employers as well as the job seekers. And couldn't be more impressed with the group that we have and the work that we've done, and I hope it's helped a lot of employers and job seekers. Okay, so I think I can now ask Kelly if you had an answer to that question about the colleges and working with them. Should they go through their career center or contact you directly or some combination?
So you certainly can go through your career centers or you can contact us directly. Our recruiters do have relationships with the local universities, especially for those in areas that are hard to fill, such as clinical lab technologists. We just mentioned Mercy College, and Mercy College actually does graduate clinical lab technologists. So that is certainly an area where we have a relationship built with the college already, and we encourage the school to provide us their alumni, their students. Bring them on. You can contact us directly or through your university. Again, we do have relationships with schools. We do post our positions on college job boards. We are in touch with the career development departments in those colleges, especially our affiliated colleges. But if you're going to a school that we are not currently affiliated with, that's okay. You certainly can contact us directly. You can ask your college to contact us directly, and we could work those relationships and build those relationships.
Okay, and I just want to underscore, I think that's a great point, that you have relationships with a lot of the colleges and BOCES and other training providers. And I've always felt that that's very important. The relationships are critically important, and that we're really trying to establish some talent pipelines. It may sound like jargon, but what we're really trying to do is develop the relationships so that the colleges know who's employing and their students and other BOCES students know who's looking to hire, so that it's not starting the process from scratch each day, each year, where there's actually a lot of information that's constantly being exchanged back and forth, so that there's more information and people are able to make more informed decisions. That's critically important. Okay, we have, I think, 2 more questions. And let's start with Kelly, and this one is, are there positions available for community health workers? I wonder if this is getting into social determinants of health and some of that community work, or maybe other types of community work.
So I'm not sure exactly what type of work the person asking the question is asking. However, I can say that we do have population health areas. So we certainly do go out and serve into our communities. And we also have home health opportunities for home health assistants, nurses, PT, OT, community liaisons, mental health workers. We have a really wide variety of positions that are embedded and community-based. So yes, we most definitely have opportunities in the community healthcare setting.
More and more opportunities. Okay, and Catherine.
Yeah, at this point, officially posted, we don't have those types of jobs right now, but we do actually have a really great volunteer group that is out and about, especially, in this current climate that we're in right now. And certainly if you wanted to send your information over and get involved, please send it over. I would love to introduce you to her. She's amazing, Jane Levy.
All right, and I believe we have one more question. And we'll start with Catherine. What position would you have for a prospect graduate of MBA in healthcare management?
Ooh, that's a nice MBA. Let's see. At this time, the positions that we have posted currently might not be the most interesting fit for you as an individual, although I'm not sure exactly where you wanted to go. If you wanted to, eventually be a program manager or something like that, I think we would have to have a little bit more of a discussion.
Okay. And how about you, Kelly?
Yeah, I'd say a pretty similar response. Again, as Kat said before, you guys are going to be tired of hearing us say that. But without knowing a little bit more about you, it's hard to just pinpoint and say, oh, yes. However, having an MBA in healthcare is an extremely attractive attribute. It's extremely attractive on your resume. So we certainly have opportunities where we could leverage your strategic ability that you've learned through gathering that MBA and obtaining that. Program director, program coordinator, such as Kat alluded to, we certainly have those types of positions, especially with having the academic medical center. We definitely have a need for people with strong operations background.
And congratulations, that's not an easy feat.
Yes.
I want to make sure you both know I will never get tired of your answers, and I think your answers have been fabulous. And I want to thank both of you for participating, for being our guest today, and providing such valuable information to our audience. And I hope you get lots of emails and lots of applications and you find lots of job matches. That would be the best reward for this event. And I also want to remind our viewers, if you could just take 60 seconds and go to westchester.org/survey to answer a few questions to help us improve our future events and to get more information to you. And I'd also appreciate it if you could go to our Facebook and LinkedIn page and like it so that you are getting more information about some of our future events and other activities. And also, if there are any other employers who are participating who have joined us today who need some help filling positions, they can contact me and I'll work with our group to help in any way we can. And I just want to finish up again by thanking Catherine and Kelly, and also all of the viewers, everybody who's joined us today, as well as our group of collaborative partners and our platinum sponsors. Thank you all, and goodbye.
Thank you.